Okay, can you hear me? Yes, okay. Okay, welcome to everybody. Firstly, I want to thank Professor Corazza and the organizing committee to invite me and to give me the opportunity to be with you this morning. With the Luta Cuscioli Association, we supported an information process on psychedelics. In 2017, an academic conference on the right to silence was organized in Genoa University. And in 2008, another conference was organized at the European Parliament with the participation of WIMAPS USA. In 2022, the book, The Bosco Fiori, you can find it, was written, and WIMAPS Italian began its process. In the meanwhile, to support the integration of psychedelics in the training path inside the university, a summer school inside the University of Pisa was organized, dedicated to consciousness and cognition, and 2 days were dedicated to psychedelic studies. And then, in 2023, a master degree named End of Life from Ancient Tradition to Modern Therapies was organized inside the University of Pisa. Why? Because we want to create here in Italy a first professional community who can grow, who can understand the therapeutical possibilities in the palliative care related not only to contemplative tradition, but also to the indigenous one. The indigenous people who work with plants and mushroom teaching plants like ayahuasca. The meaning of ayahuasca, and 2 words, ayahuasca, the plants of death. Not because the plants kill you, but because the plants can teach you how to die. So, for the first time in Italy was created a course with 20 hours dedicated to psychedelics. But why psychedelics can be so important at the end of life? Because they can't face what is called psycho-existential distress. What is it? You can read it there. It's a group of symptoms of the overlook characterized by resignation, loss of sense of living, suicidal thoughts, and amplified perception of pain. And even if the palliative care, the intent of palliative care system is to support the patient, we need a new approach, an holistic approach, to take into consideration not only the physical pain and physical environments, but also the emotional one. And psychedelics can be very effective. The pioneer of the studies related to the use of psilocybin in palliative care was Roland Griffith, probably some of you know him. And he worked at the University of New York, and he analyzed how a single dose can reduce the effect of anxiety and depression at the end of life. And this result can last for months and years. Professor De Pisapia showed this study before. This is a milestone study, and it was made on healthy volunteers. And as you can see, the study is a double-blind study, and you can see how the effectiveness of psilocybin and the new pathway that you can see inside the brain during a session and the psilocybin. But what is important is not only what happens inside the brain, but it's also the setting. So the psychotherapeutical part of this process. You can see how familiar is the environment. The use of a selective music during the session and the presence of two therapies, one medical doctor and one psychotherapist. This is the study that Griffith made, and this is an overview. So there are some preparation session, 3, and then the dosing session, and another part very important dedicated to the integration. Then another session and another integrating part. The first section is dedicated to education, so the purpose of the study of the section, the expectation of the person, the possible side effects of the medication, the aesthetic, autobiographical, mechanical, mystical state that the person can reach or has really during the talk of the first talk we can listen to the role of the music and of the study and of the self-observation. Another preparation session, tell your story, the story of the disease, of the cancer, of the treatment that the person has to face, and also the story, the personal story, the belief of social, religious engagement, previous experience with psychedelics, is sort of meditation, and values and fears and hopes and also dreams. This is a typical day for a dosing session. The person arrives early in the morning. The session starts for example, here at 9, and ends about 5 p.m. So it's a long day and it's a long work both for the person and for the therapist. Headsets and earphones are used. And during the session, there is always a monitoring of what is going on, and this is why it's very important, the presence of the two therapists. Usually, the dosing session opens with a ritual. There is a meditative position that focus on support the medicine effects. So this is why it's not only the medicine, but it's the environment and the situation that is created. The person is encouraged not to think about cancer, and what is the role of the true therapist is to be present, watch, listen, achieve, and sustain the person during the process. And what is also important at the end of this day, so the person cannot go home by himself. It's necessary to have a taxi because safety, it must be one of the most important things during the process. And the person is encouraged to call therapist for any problems and to remain quiet and to think and reflect on the experience. I put this study that was made by Ross, who was a colleague, is a colleague of Roland Griffith. Roland unfortunately died last year. But what you can see here, the study was made in 2021. He checked the long-lasting effects of psilocybin and the data he obtained. So the first study of Griffith was in 2017, and in 2021, Ross confirmed the reduction of anxiety and the fear of death and depression. So in combination with psychotherapy, a single dose or 2 doses of psilocybin can produce rapid and long-lasting anxiolytic and antidepressant effects in dying persons. So also LSD is another interesting substances at the end of life. You can recognize this guy. He is Albert Huxley, who wrote two interesting books, The Gaze of Perception and The Island. Huxley asked at the end of his life, on his deathbed, to his wife to give him 2 doses of LSD. Today in Switzerland, LSD is a treatment allowed for terminal patients. So I would like to conclude with a video that I made with Andrea. Andrea is a young man. He lives in Switzerland, and he was diagnosed at the age of 39 with a 4th-stage colon cancer. Unfortunately, he cannot be here with us, but he gave me the opportunity to make this interview. He had the opportunity from 2019 to be treated for existential distress with LSD. So I want to give him the words in order to listen from his mouth the real story. So let's try.
Okay. Thank you, Andrea, for being here with us. And can you share your story with us?
Yes, Tania, thank you very much for inviting me and the possibility to share my story, which I always accept with pleasure. I was diagnosed with stage 4 colon cancer in 2019, so now more than 5 years ago. I had obviously several surgeries and lots of chemotherapy sessions. And after that, I was somehow very attracted to try something different. While I was still doing all my therapies, I was attracted to actually LSD, which is something that I'd never tried in the past because of the bad reputation that it had. But I was always somehow attracted to this substance and curious to try it. And so after this diagnosis, I learned that in Switzerland there were clinical trials going on who measured fear of death with the use of psychedelics. So I signed up for this clinical trial in Solothurn with Dr. Gasser and Dr. Roeskamp. And I was lucky to participate in this study, which consisted of about 10 or so psychotherapy sessions with a therapist. And 4 study days, we call them. And these study days, 2 of them were with LSD. We're talking about 200 micrograms of LSD, and 2 were with placebo. And actually, the very first session we had spit out so much material that even 5 years later, I'm still understanding some of it to this day. Most importantly, maybe in my experience, I could really see how small my current existence is compared to what I actually am, and that my identification with Andrea, so the person I'm here, is a temporary identification, and that I actually could go back in time. I could relive my birth, and many births before that. I can see how my existence was actually very small, like a grain of sand on a beach. And so it changed quite a bit the way I see death. It's not something that ends, but rather something where I go back to a stage in which I'm much more actually than what I am, no, this temporary existence that I'm living here. Yes. Now I forgot your second question, actually.
Okay, the second question is related also with your family. So using psychedelics, not just your fear of death, but also the fear of your family and the relation with your kids.
Mhm. Well, it was kind of the hardest thing is actually being diagnosed with a really deadly disease, in which you don't know how much time you have left. The hardest part for me was actually the the relationship to my children. I'm a father of three. At the time, they were young. Now they are 15, 13, and 8 years old. And it's actually to accept in a certain way that they have their destiny. That I'm not so how do you say indispensable as I used to think. Maybe that of course it's taking away something from them if I die young, but it can also be an experience that strengthens them in different ways. No? And altogether, I tend not to judge that much anymore. Differentiate between what is right and what is not right, and what is good and what is bad. Um, Somehow, with the substances, this all became more um, undefined in a certain way. And now I can look at this experience and I say, yes, it's hard. Yes, it's hard. There's been lots of suffering, but it's also given me a lot. And altogether, I accept it as an experience that I'm living now.
Mhm. Um, do you suggest this kind of experience to all the person who are facing this kind of disease and
Hard to say. I see lots of people are afraid of
Mhm.
this experience, and it's fully understandable. It's a lot about losing control. I was afraid of it too. Um, but then I haven't mentioned yet. After being part of this clinical study, I was lucky to enter a therapy group. We're about 10 people. We meet every 3 months or so with substance. And also there, I see lots of suffering, obviously, during the sessions. Um, but the patients always come back in a certain way, which means that it must be useful. It's a very useful experience. It's not an easy experience. It shows you things about yourself of which you are not aware, which maybe sometimes it's part of your childhood, things that you've forgotten or things that you're ignoring, that you're not giving importance to. But sometimes it's also other generations, your parent or your grandparent generation. It's showing you, in a way, it's showing you trauma or unpleasant experiences altogether that the where there was pain and we didn't want to live that pain anymore. So we have a tendency to either forget or not just ignore it somehow. And so with these experiences, it definitely sheds light on these things that you're ignoring about yourself. So it can be scary, of course, and I hear from many people who don't want to have this experience. Would I recommend it? Absolutely, yes. But not only to people who are, let's say, in palliative care. Altogether, it's an experience that everybody should try at least once.
Okay. The last question is related to the person who were with you during the session. So the importance of trusting them and being part of the preparation, not just the session, but the preparation and the integration. So.
Yes, I think it's very important that you trust or you feel like comfortable with the person you are who is there for you during this trip. I had only one therapy session actually before having the trip, and I immediately felt comfortable. So I said, okay, I can trust this person. I can, because you are in an extremely vulnerable situation at that moment. And no, you really have to be comfortable that this person will take care of you, look after you. Yes.
Okay. Okay. Thank you so much for sharing your experience, and we really want. I know that you were here in Italy, and you are, even if you live in Switzerland, you are part also of the movement here in Italy. Just to give this possibility to all the people.
Yes, it's important for me actually to help giving access to this kind of therapies, which are extremely safe, and yes, they should really be available.
Okay.
Thank you, Tania, and enjoy the rest of the Congress.
Okay, thank you. Bye.
Bye.
And thank you. Hopeful with meeting the conference, watching the conference. And before concluding, we really hope that all the people all over the world and also in Italy can have the same treatment that Andrea received. So thank you so much for your attention.